We are Gateway for cancer research. This year alone, nearly 1.6 million people will hear these three words: you have cancer. Sadly, 500,000 people will lose their fight against cancer this year as well. Gateway is here to help, and so can you. Since 1991, Gateway has funded more than 140 breakthrough clinical trials around the world. One of those clinical trials is happening in Seattle, where the Seattle Children's Hospital is revolutionizing how surgeons find and treat pediatric brain tumors. Meet Dr. Sarah Leary, a doctor empowered by Gateway to develop new treatments for pediatric brain cancer.
This is the first time that Tumor Paint has been used in children. This is a trial to see if we can use a molecule called Tumor Paint that was created in Seattle to help surgeons be able to see brain tumors while in the operating room in real time and with high definition. And we think this may revolutionize cancer surgery in both being able to improve the ability of the surgeon to get the tumor out and also to leave the healthy brain intact.
An unlikely marriage between a scorpion's venom and a fluorescent molecule made the perfect compound for attaching to complex brain tumors and making them glow under fluorescent light. Even in the most experienced surgeon's hands, surgery can be extremely risky and potentially damaging. Normally, a tumor would need to be a few million cells for a surgeon to be able to identify the tumor. Tumor Paint allows them to see a few hundred cells, and those cells glow. Meet Samantha, a mom whose baby at 6 months of age was diagnosed with a brain tumor. Wes was diagnosed with ATRT, a brain tumor with minimal survival rates. Normal treatment encompasses brain resection surgeries, followed by 6 months of intense chemo and 6 weeks of proton radiation therapy. Wes has been hospitalized since he was 6 months old.
They did a simple MRI and where they just took a couple views, and the doctor came back and he just had this look on his face, and he said, "I have some awful news." And here I am sitting there thinking that it's just that there is brain swelling or fluid or something like that. And then he said, "We found a tumor on his brain." And the surgery being the most critical thing at that point was to remove that tumor. All of our staff, and specifically Dr. Leary, they've worked so hard at keeping my baby alive.
All of us have been affected by this awful disease. My grandfather died of cancer. I've watched countless friends struggle with the side effects of their cancer treatments. I want to assure my 9 grandchildren that in their lifetime will find better options for treating cancer, so they don't have to fear those 3 words, you have cancer. We have our own 3 words, be a gateway, so that we can continue to fund innovative trials, save the lives of real people, and pave the way for a better future for all of us.